Hello to everybody, and greetings from Sicily, from Giuseppe Micali. Today we will talk about some consideration for innovative acne management program. Acne, is a chronic inflammatory disease, most common in early adolescence, rare in pediatric or in adult patients, which show many different clinical presentation. The clinical hallmarks of acne mostly consist of non-inflammatory lesion, namely closed and open comedones, and inflammatory lesion consisting of papule, pustules, and nodules. Of course, we can have also scars, but those are a late stage of non-inflammatory inflammatory lesion. What are the important to say about acne? Its prolonged course can lead to scarring and cause significant disfigurement that severely impacts patients' life. And this can be distinguished in emotional sequelae, a negative psychological impact, low quality of life, and health-related quality of life index, negative social perception of patients with acne scars, and also physical discomfort, mostly due to a body image disturbance. Those are the four pathogenetic mechanism. You all know about this. Based on the these known pathogenetic mechanisms, there are topical and systemic agents which are available. Topical agents mostly consist of retinoids, antibiotics, antimicrobials. We can have also other topical agents like salicylic acid, azelaic acid, and then systemic agents mostly based on retinoids, isotretinoin, or antibiotics, or hormones. Pharmacological agents, by the way, remain the main therapeutic approach for almost all acne clinical types. But don't forget that the use of many of these products, many drugs, may be associated with some adverse reaction. In particular, this side effect may decrease the patient compliance and adherence. As you can see here, most of them, they're associated with erythema of various degrees, most with tretinoin, scaling, burning, flare, or photosensitivity. So that's why, especially for mild form, many physicians prefer to consider firstly the use of dermocosmetics. Why? Because they can use in different situations, as a prevention and maintenance, using a synergistic effect with drugs, target another pathogenic factor and or improve the efficacy of another acne treatment. They can be helpful, the dermocosmetic, in the management of side effects, alleviating side effect of other acne treatment and potential skin barrier defects, and also improve patient adherence to pharmacological acne therapies. Can be associated with drug therapy or can be used as alone. If correctly prescribed, play an important role in acne treatment. May cause improvement in acne, may improve barrier function, which can be damaged in patients with acne, may reduce the presence of sebum, may reduce the side effect of acne treatments. This is a recent multi-center prospective observational study we performed in Italy using a salicylic acid-based daily regimen for the treatment of mild comedonal papular acne. This daily regimen consists of a cleansing gel, which is considered a cosmetic, which is used twice daily, that contain 2% salicylic acid, urea peroxide, and glycolic acid, a moisturizing gel in the morning, which is a medical device, again, based on salicylic acid combined with nicotinamide and saccharide isomerate and vitamin E, and then a purifying gel, again, a medical device to use at bedtime with salicylic acid, zinc taurine, urea peroxide, and vitamin E. So as you can see, a common denominator is the use of salicylic acid, ranging from 2% in the cleansing gel to 2.5 in moisturizing and purifying gel. A multi-center prospective conducted in 4 centers, north of Italy, center and south of Italy, between December 18 and March 19. Basic inclusion criteria: wash out as a rule, no topical product or drugs except for makeup and oil-free SPF 50 and sunscreen. Exclusion criteria: standard exclusion criteria, including severe underlying disease, exposure to sunlight, and pregnancy and breastfeeding. Material methods consisted of clinical assessment with total lesion count, baseline after 4 and 8 weeks, investigator global assessment using the following score: unchanged, grid improvement, improvement, mild improvement, worsening, instrumental assessment with the erythema digital, directed digital photography, in this case for evaluate inflammation, as well as response to therapy or side effects. And from the patient side, visual analog scale for patient discomfort, and tolerability, acceptability, and 4-8 weeks for evaluation of redness, desquamation, stinging, and burning, and acceptability, rapidity absorption, oil residue, ability to spread, stickiness, perfuming, by a 4-point scale. 41 patients, 28 female, 13 males, average age 20 years, number of non-inflammatory, inflammatory lesion at baseline, mean value 16 comedones, almost 8 papules, main value for comedones and papules. At 4 and 8 week, a significant reduction of non-inflammatory, inflammatory lesion compared to baseline was observed. Comedones went from 16 at baseline to 14 and 4 weeks to 8 at 8 weeks, so half of the value. Papules for almost 8 at baseline to 6.4 to 4. So we have, as you can see, from 16 to 8 and from almost 9 to 4.4. As regards the overall assessment of clinical outcomes, at week 8, IGA showed great improvement in 40% of cases, improvement in 26.6%, mild improvement in 20%, unchanged in 10%, and worsening in 3.3%. Regarding patient discomfort related to acne, VAS, a significant reduction of VAS score at week 4 and 8 compared to baseline was recorded, 6.2 versus 5.2 at 4 and 4.3 at 8 weeks, significant results. And patient tolerability and acceptability showed at 8 weeks a tolerability of 90% rated as excellent, acceptability of 97.5 rated again excellent. Some personal experience, some cases, mild acne, as you can see here, with comedones and papules, inflammatory papules, and papules scattered in the cheeks, a baseline after 4 weeks, after 8 weeks. As you can see, mostly of these inflammatory lesions are gone. We have only post-inflammatory hyperpigmentation. As you can see here with the erythema digital photography, before and after, most of these inflammatory lesions are gone. Some of these are post-inflammatory hyperpigmentation, so the result is pretty good. Again, another case with mild acne, comedones, and papules on the forehead and the cheeks. And as you can see here, at 8 weeks, there is improvement. All of these are gone, all of these inflammatory lesions. Some residual lesion here, mostly are hyperpigmentation. There is a new lesion here, but there's nothing we can do with this. It's a lesion that appeared just a few days before the 8 weeks control. Again, another case with inflammatory lesion on the cheeks. At the end, those are all residual post-inflammatory hyperpigmentation, and erythema-directed digital photography clearly show improvement of this inflammatory lesion and also show that these are inflammatory, post-inflammatory hyperpigmentation and not active lesion. The mechanism of action is mainly due to this cocktail of ingredients: salicylic acid, keratolytic, anti-inflammatory, nicotinamide, control of sebum, and also decrease inflammation. Ura peroxide is an antiseptic against Corynebacterial acne. Glycolic acid as a keratolytic agent. Zinc taurine as another inflammatory combination. And saccharide isomerate works as an excellent moisturizer. They act on all pathogenetic factors of acne. Conclusion, the results indicate that the combination of salicylic acid-based daily regimen represent an interesting approach that, in my opinion, undoubtedly deserve attention when to use mild inflammatory acne in patients that prefer to start with a non-aggressive treatment, in association with conventional therapy in patients with a good tolerability, and as a maintenance treatment. Importantly, is not photosensitizing and may be used during summertime. Thank you for your attention.